Great, thank you. In the next 5 minutes, I'm going to explain how YOURmeds can help improve health outcomes and increase independence of service users, as well as improving their life choices. So YOURmeds is all about helping people take the right medication at the right time with support from their network of family and friends. So why is medication management in the community important? The NHS and World Health Organization widely recognise that only 50% of patients take their medication as intended. In the UK, we spend £9.61 billion on prescription drugs in the community. Academics widely recognise that increasing adherence to 80% across just 5 diseases would save the NHS £500 million. But the true impact of poor medication adherence is actually felt in social care. Some councils, like West Lothian Council, commission 15-minute medication visits to help people become more adherent with their medication. Whilst other councils don't commission medication visits, but then the social workers put in an element of personal care so that they can provide that support in a different way. West Lothian Council use YOURmeds, and they found that they've managed to save 6,500 visits, which they've then repurposed to help additional people into their service. They saw a return on investment of 9 times. And within Leeds, one user managed to stay within their home for 88 days using YOURmeds, saving the council £7,190. The daily task of taking your medication every day also provides great data. West Lothian Council use that data to inform decision making, because they can actually recognise when someone's cognitive abilities are diminishing, often faster than the families and carers. The West Lothian and Leeds case studies are available from our website if you want to download those. So how does our system work? Well, at YOURmeds, we believe technology should be inclusive, and your digital literacy should not stop you from accessing that support. Our oldest current user at the moment is 97 years old. Similar to an advent calendar, the smart tag shows a number when it's time to take your medication, and it beeps 6 times. And the user then opens the corresponding pod on the pack. The tag works off mobile data, so you don't need Wi-Fi or broadband in the property. The packs are filled and delivered by your local pharmacy, and the packs were designed with the pharmacy workflow in mind, so they can be used with pharmacy robots. In the last 9 months, we've signed up 150 different local independent pharmacies across the UK. A user can also nominate 5 supporters. So 10 minutes after the initial alarm, the first supporter is informed, and then a new supporter is informed every 10 minutes. So you know if you're the 5th supporter, the 4 people ahead of you have been pretty useless and you need to make that call. You can call the user directly through the app, and with simplicity in mind again, we only give the supporters the information they need about the medications that were due yesterday, what's due today, and what's due tomorrow. The supporter app is available on Android and Apple, as you'd expect. The third part of our system is the dashboard. Here you've got the real-time data, so you know when medications were taken, if they were missed, if multiple ones have been taken, or if the wrong ones have been taken. It also records when the supporters inform or what the supporters are doing. So you've got a full audit trail of what's going on with these users. The pharmacist can also adjust the medication rounds remotely from the dashboard. So if the GP asks for one of the drugs to not be taken, then they can do that remotely. We're proud to say that YOURmeds is made in Britain, and we own all of the IP and technology, and all of our processes are held in-house, allowing us to be flexible and agile. We strongly believe in co-production, and through our early engagement with West Lothian Council, we've ensured that our product is fit for purpose and provides the council with the data that it requires. So we believe the real-time data that our system collects is an important part of the jigsaw in understanding a user's outcomes. Take falls, for instance. Poor medication adherence can often lead to falls. Taking your nighttime meds in the mornings is just one example. We operate an open API and are happy to push our data into other platforms. So if you're monitoring health data like SpO2 or blood pressure, we can provide that medication adherence data, which is an important part of that jigsaw, and it can also provide the efficacy of the prescription that's been provided. Over the summer, we crunched some data, and on average, YOURmeds achieves an average adherence rate of 84.4%. During lockdown, that adherence level went slightly down to 82.2, but these were all unsupported medication rounds. I know women are usually better than men at most things, but in this case, our male users are slightly more adherent, 81.7%. But our older cohort, our over 79s, actually have an adherence rate of 90%. We think the younger cohort are probably out a little bit more, so that's why they're less adherent. We also know that 1 in 4 of our adherent rounds is due to supporter intervention. So that supporter nudge is really important. And YOURmeds is the only system that uses that supporter nudge to provide that adherence. Everyone needs a little help now and then, and YOURmeds provides an easy way to provide this. Within councils, we work with a number of areas, from reablement, hospital discharge to supported living. In Wigan, we've started working with their dom care providers to increase capacity within the system. And in Manchester, we're working with the Parkinson's and Stroke district nurses to reduce the workload on the teams. Early data showing that by improving medication, users are becoming more independent, and 2 out of the 5 active users that we've got at the moment have actually left the service, the Parkinson service. We've also seen that the carer burden on the primary carer is reduced, firstly through the user becoming more independent in taking their medication, which can be up to 8 rounds a day with Parkinson's, and also by allowing extended family members to support the user. This allows the primary carers to gain some independence back. We've also just started a programme with South Tyneside Council. By the end of the year, we'll be working with 11 councils across the UK. Our processes are streamlined, and we can have a YOURmeds project up and running within 6 weeks, and that includes onboarding local pharmacies and training your referral teams. Medication.
You've
got 1 sentence left. Medication in the community is broken. The inceptions of the ICS provides a great opportunity to address this important issue, and YOURmeds has a cost-effective solution that's easy to implement. There we go.